is addressing the plastic plague that we find ourselves in, and that is by reducing the use of plastic straws, which we know is just the tip of the iceberg. Next slide. And I'm also honored to be joining Beth Eckel from Practice Greenhealth and our other panelists from Seattle Children's and Inova, and look forward to learning about their efforts and engaging in conversation with all of you. Beth, I don't see if the slides are changing, but I just am going to assume they are. Would that be all right? I'll just say next slide.
They have changed, I guess so. I'm sorry if it's not showing on your
No, that's
screen.
all right. Okay, so we're at the overview. So I'll start by sharing a little bit about why we eliminated plastic straws, what were the drivers, the strategies that we used to implement it, how this effort is perceived, what alternatives are being considered, and the next steps. Next slide. So why did we make this decision to say goodbye to plastic straws? First, I'd like to tell just a little story, and it all started when Shelby O'Neill, who is a Girl Scout from Central California and founder of the Junior Ocean Guardians, was watching one of our Dignity Health commercials that showed a little boy blowing out his birthday candles with a straw. And following the commercial, Shelby emailed our CEO, Lloyd Dean, letting him know that she really appreciated the advertisement, but alerted him to the dangers of plastic straws and asked if he would consider reducing their use at Dignity Health. Shelby's note stood out because of her strong commitment to reducing plastic waste, and Lloyd took her letter very seriously. We've been paying attention for years to the products we purchase and the waste streams we create, but the straw issue was one that we had not yet addressed until Shelby's letter. Another driver was all the compelling data about the plastic waste which we create, which we all know, and Beth began the conversation on it. But I think at least a few points are worth repeating. Americans use 500 million plastic drinking straws every day for just a few minutes, and then we toss them away. Every 9 minutes, plastic weighing as much as a blue whale ends up in the ocean. It's estimated that plastic in the ocean will outweigh fish by 2050 if we don't dramatically change course. And just something else to consider, plastic in general can entangle marine animals or they mistake it for food. It never disappears or biodegrades. It just breaks down into smaller and smaller pieces and actually becomes more toxic in the ocean because just like a sponge, it soaks up pollutants and pesticides from the surrounding seawater. And those concentrated toxins get passed up the food chain as big animals eat the little animals, and the toxins continue to pay it forward in a negative way. Marcus Erickson, who is an environmental scientist and co-founder of the advocacy group 5 Gyres, calls this the smog of microplastics. Next slide. So Lloyd reached out to colleagues at Dignity Health, who then assembled a task force that included representatives from our marketing department, supply chain, nursing, food and nutrition services, and sustainability, so that we could find a solution to our practice of using single-use plastic straws for a few minutes and then throwing them away. And this was not something that we wanted to continue doing. And at our first meeting, as you can imagine, we talked about the areas that we should consider. Would it be clinical or non-clinical? What were the options? Would there be other items that we could eliminate? How would we communicate the change to everyone? Next slide. And basically, what we did is we decided to eliminate plastic straws from our non-patient food service areas. So in some facilities, paper straws are available at the soda station and special condiment area. And at other facilities, paper straws are available by the cash register or upon request. Next slide. And so right from the get-go, when the members of our committee got together, we talked about making sure that anyone who depended on plastic straws would have them available. We all know that patient safety and comfort come first. Sometimes patients depend on straws for hydration and nutrition. They could be reclining in a bed or unable to tilt their head or swallow, and perhaps they find it hard to breathe. So for a whole variety of reasons, it may be difficult or even hazardous for them to drink liquids without a flexible and durable straw. So for them, straws are not just a convenience but a necessity. So again, at this point, plastic straws are available in our patient care areas. Next slide. So I'd like to delve just a little bit deeper into our conversations. We talked about the alternatives to plastic straws that we might use in our non-patient care areas. And that included the bamboo straws, plant-based straws, stainless steel, some that had the bend in them or some that were straight, aluminum straws that come in a wide array of colors. I thought the pasta straws were very creative. They're in the picture in the right-hand corner. But we did land on paper straws made by Kraft, and we purchased them through our distributor, U.S. Foods. In terms of availability, our choice was based on availability, given the timeline we were trying to stick to. We wanted this change out to coincide with the No Straw November campaign, although we knew that that was going to be a bit of a stretch. The change would become effective on December 1st, 2017. And we wanted to ensure that all of our facilities received the same paper straw at the same time. Our colleagues from supply chain looked into pricing of the various options, and we were aware, of course, of the price point. We had been paying for plastic straws, but we landed on the paper straws and found that it was going to be a little bit more expensive. In our discussions, we discovered that we could do more than just reduce straws. Why not eliminate the plastic stir sticks and replace them with wooden ones? Actually, we thought that would be an easy switch. No one needs a plastic stirrer. By making these changes, we determined that we could prevent more than 4 million plastic straws and stir sticks per year from ending up in our oceans that could harm wildlife and pollute our waters and ultimately impact our health. Next slide. After the decision was made, our colleagues from communication began preparing materials for the various audiences that needed to know about the change, and we wanted them to understand what we were doing on a system-wide basis and why. And it was also a good time to remind everyone that this was not the first action we've taken to reduce our use of plastic throughout the hospital, and it would certainly not be the last. We've had a commitment to sustainability for many years, and it's held within our larger mission to heal communities and the environment, in addition to providing quality care to our patients. So listed are the audiences that we needed to address. Our Chief Nursing Executive Officer addressed this issue with our executive leadership team. Our Food and Nutrition Services leads were notified at meetings and by email and given all the logistical information they needed to complete the transition prior to the end of November. There was a letter to all the presidents letting them know about the change out and why we were doing it, the timeline, and who they could contact if they needed to. And patients and visitors to our facilities were notified by our nursing staff and by the placement of flyers and signs in our retail food service area. The change was communicated to employees through facility newsletters, morning huddles, signage provided to our internal communication leads, and just recently a video was released by our Dignity Health brand marketing department about our move away from straws and stir sticks, and Shelby is featured in that video. And of course, we certainly wanted to respond to Shelby for speaking out and creating this awareness that straws are something we can almost always do without. We wanted her to know that we were listening, taking her comments seriously, and that it was young individuals like Shelby that make us very optimistic about our future. Next slide. This is a flyer that was created for our cafeteria, and I've also included on this slide in the bottom left-hand corner the link to our 1-minute video on our straw story. Next slide. Various members of the media picked up our story. And the next slide. And while there are many who have applauded our move away from plastic straws, it's not everyone, quite honestly. There are those who say they miss the plastic straws. So the paper straws were initially not well accepted, but once people understood why we made the change, most customers came on board and accepted them. And I've included two pieces of feedback here. The first one in yellow, one commending us for doing our part, and the one on the right-hand side, we received a note from one of our employees who very much appreciated the fact that we didn't ban straws altogether. Her relatives, who live in a different state, had recently adopted a beautiful little boy. He was born with no arms and legs and relies heavily on straws for drinking. So when they go to restaurants or wherever they are at. So she was glad that Dignity Health reduced our use of straws, but that has them available for anyone who might need them. Next slide. All these steps here are very much connected. We made this change at what seemed like warp speed. I don't know if I've seen anything happen faster. We'll continue to explore all the alternatives as they come up on the market. We're going to work with vendors and manufacturers who are innovative and can come up with solutions that help us meet our mutual goals. They play a critical role and can create that avenue for further change. We're going to continue to partner with Greenhealth Exchange so that we might even eliminate the plastic straws and make sure we do get the most sustainable one and the durable and flexible ones at a cost that doesn't break the budget. As a healthcare provider, using single-use plastics every single day, whether that be needle counters, skin staplers, blue wrap, food utensils, packaging, we know that the list goes on, and it matters that we make progress in reducing our waste in these areas as well. We're learning from others, such as on a webinar like this afternoon, and from our discussion that follows with all of you. And someone called straws a gateway plastic, and I agree with that. I think a straw is so small and light that it may seem insignificant, but it just might be the thing that sparks a conversation around the throwaway society that we're all living in, and how to solve the much larger issue of plastic pollution and how all of this is affecting our health. It matters that we continue to create the conditions for healthy people and planet, which is, after all, our mission. So I'd like to conclude in the last slide with just a word of gratitude to all those who are taking bold and brave actions to call our attention to this challenge. Practice Green Health for this webinar, the Plastic Pollution Coalition, all those cities and states and restaurants and organizations across the country who are addressing this, Greenhealth Exchange for helping us explore alternatives, and all those innovative individuals and companies who are coming up with solutions. So thank you for this opportunity.
Great. That was wonderful, Mary Ellen. Thank you for sharing that with us. And now I'm going to pass the ball over to Emma Eichelman with Inova Health. Emma, I've made you the presenter now.
Hi, everyone. So like Beth said, my name's Emma Eichelman, and I work at Inova Health System. So I'm going to be talking a little bit about our plastic straw reduction initiative. We are really just in the midst of it. We just started a couple months ago. So our drivers, it actually came as a request from our new CEO. Our sustainability office has been in place for a while, but with only 2 people in our office right now, it is hard to really see the effects of everything we're doing. And so this was very similar, came from our CEO, and it's a way to look at other single-use plastics that we can reduce across the system. And just since we have started discussing this and putting out the press release and some other marketing materials, we've already had people approaching us, not just clinical and not just from the hospitals, but some of our off-site locations as well, asking if they can get rid of plastic stirrers, plastic utensils, styrofoam cups, etc. So this really is a gateway plastic. So our strategies, this really began, it began actually with the press release, and like Mary Ellen spoke to as well, this happened very quickly since it did come from the CEO, and we thought that this was also a really great idea. We began discussing with our food services and supply chain to make sure that we could even get a large enough supply of whatever alternative that we decided. We originally had some issues because there's very high demand and very little supply, especially where we are. There's a lot of restaurants that are on the coast that are starting to make these changes out east. So we finally decided on a sturdy paper straw. A lot of people have had some issues with the paper straw, but the only one that was similar to plastic that we could find, we discovered still had, I think it was 70% plant-based, and the rest was still technically plastic. So we didn't feel that that was enough to say that we were getting rid of plastic straws. So we did decide on a paper straw. So after we had finally been able to get enough supply that would be ready, and this is going to roll out on December 1st of this year, we have had meetings with, we have 5 major hospitals, and we have had meetings with each hospital's individual leadership so that we can let them know the changes that are coming and help them to be educated for when people start asking them questions as well. And we've formed a cohort group of representatives from different functional areas to work together on the rollout process and also our marketing. So this is different clinical representatives, nutrition, speech pathology, operational, so our support services, leaders, and food services. And we also have language and disability services. We want to make sure that we're in no way hindering anyone from drinking by changing the type of straw that we're offering. And then also internal communications. They're helping us get the word out as well as create some of our marketing materials that will be in the cafeteria shortly. And we really did put this cohort group together because we wanted outside input, and they all have really different perspectives, but it's really helping us get the best message across. So I spoke a little bit about our alternative that we chose, but something else, we really are trying to encourage people to skip the straw altogether if that's possible. As of now, we are ordering paper straws in the same quantities that we are ordering plastic straws, but we're tracking the data over time to hopefully see a decrease in overall straw usage. So that will be one major feature on our marketing materials once they are produced, that this is why we are getting rid of plastic straws and how it's affecting our environment and the oceans. But also, if you have the ability to go without a straw or perhaps can purchase any sort of reusable alternative, for example, the stainless steel straws, give them the opportunity to do that and hopefully bring those with them from now on to the cafeterias. And something that we've just recently started discussing with the people who are in charge of our retail shops is that we want to be able to put metal straws in the gift shop so that people can go purchase them there and make it very easy. They don't need to go out of their way to have a reusable straw, and that can really help decrease our overall straw usage. And I did want to note that since we did have a bit of backlash from people worried about individuals with disabilities that are in our cafeterias, we will still be having a very small amount of plastic straws that are going to be kept by the cashier that can be given out on request for people that really do require them and can't use the paper straw. So lessons learned, this all kind of goes with that after the first press release, we did experience backlash, which was when we brought in the Disability and Language Services Department, because we didn't want to discriminate against anyone. We really don't want this to have any sort of negative effect on any of the individuals, whether it's staff, visitors, patients that are using our cafeterias. And so bringing them into the discussion was really helpful. It gave us a different perspective and made sure that these alternatives are going to be able to be used by everyone. And they've seen our marketing, they've seen the straw alternatives, and they've approved all of this. So we're really confident about that. And really other feedback, overall, there was a lot on social media about this. Our social media staff said that it was the highest she's seen in her 8 years of being at Inova. It was mostly positive. Beyond the few negative comments we got, other people were very excited about the changes we're making and obviously hope to see other changes continue to be made. And while we are doing a lot in our department at Inova, sometimes it's hard to have that be seen, and we still have a lot to do with styrofoam, plastic utensils, and other things like that. So our next steps, since we are really right in the middle of this whole initiative, there are quite a few next steps, and two biggest ones right now. So first off is marketing. We have both internal and external marketing, and internal is something that this week and next we are actually hosting tables at each of our 5 major hospitals to announce the initiative, answer any questions, show them what the straw will look like, and show them some reusable options. So it's really making people fully aware of what this is going to look like and the changes that they will be seeing, and make sure that no one has any more questions or concerns. So trying to get that out of the way right at the beginning before the straws are even physically changed in the cafeterias. And something I put on here, we're tying this in with something called our Just One campaign, and this is a system-wide campaign where we're encouraging both community members and employees to take environmental actions or submit an idea of how they can reduce their environmental impact, whether it's in their community or at their individual hospital. And we want to tie this in so that people are seeing that it's not just about eliminating straws, it's really about all the different steps that they can take to reduce their personal environmental impact or the environmental impact of Inova. And I think that tying this all in is really putting this beyond just straws. For external marketing, we are working with Creative Services, and this will be signage for the cafeterias. I don't know if I specified this, but our straw reduction as of now is just in non-patient retail areas, so pretty much just cafeterias and our little cafes. It's not clinical areas as of right now, since we are at the very beginning. Clinical will come soon, hopefully. We have had some clinical directors already reach out and say that their unit doesn't need straws. They have patients that can go without it, and they are willing to switch either to paper or just eliminate straws altogether. But obviously, there are plenty of units where the patients do require plastic straws, bendable straws, and that's something that is the most important. So we have not touched clinical areas yet. But the marketing, the external marketing will be signage in the cafeterias, as well as the TVs in the cafeterias, in the lobbies, and little table tents with information to go on all of the tables where people will be sitting. We're really trying to let everyone know why we're doing this. And the first will be, so starting this week, we have our Coming Soon materials. Again, just goes along with the tables that we'll be hosting, really putting this out there before the straws are taken away so people can anticipate this. And so we're hoping to have, this has now changed to December 1st, just in the past couple of days, but our old plastic straws will be replaced by the paper ones now on December 1st, and that's official because that's when our supply will be coming in. And again, like I said, the signage will be discouraging people from taking a straw altogether, but there will be some plastic straws left if people really do need one. And so that is all that I have. It is really interesting being right in the midst to do this webinar, and I think it really is a great initiative. And although at first we were a little bit overwhelmed and thought that this might be something really difficult, all the leadership is on board and has been really great and helpful for me and my director in the Office of Sustainability. So this definitely is something that is doable, and I think will make big impacts with the rest of the single-use plastics as well.
Great, Emma. Thank you so much for sharing your journey, and it sounds like you're getting ready to launch very soon. So that's great. Wonderful. I wanted to just mention to everybody that we encourage you to submit your questions. We've already received a few already. So feel free to put your questions in the Q&A box at the bottom right corner of your screen. And now I'd like to turn it over to Colleen Grohl and Michael Shelton from Seattle Children's Hospital. Colleen?
Thank you, Beth, and hello, everyone. I am here with Michael Shelton, our nutrition buyer, and we will tell you about our journey with straws. And Seattle Children's, just stating the obvious, it's a pediatric facility. So can you see the slide now, background City of Seattle mandates? Is that the slide that's showing up now?
That's the slide that's showing, yeah.
I just want to make sure. Okay, so big picture, composting has a long history in Seattle. All commercial buildings are mandated to compost from food service areas. Residential housing is also required to compost, and that's been since 2010. And we have a robust infrastructure for composting. Cedar Grove has a really big facility here. They're our commercial composter. And then food service businesses were required to find recyclable or compostable alternatives for containers and cups starting in 2010, and then for straws and utensils as of July 1st this past summer. So it was nice having a phased implementation approach. We've been composting since let's see here. We've been composting since about 2009. And the other nice part about the City of Seattle mandate was they require composting and recycling containers so that if you're at a restaurant, for example, and you get a compostable container, it doesn't end there. You actually have, there's a compostable bin for you to put it in. So even though that sounds like it's a normal thing, that was an important part of the requirement. And then City of Seattle's been really patient and working with all of us, and they do exemptions, and this is reviewed annually. And for the most recent regulation around straws and utensils, they made flexible bendy straws needed due to medical conditions, so basically hospitals, exempt. So when we started this journey, we absolutely plan to roll out compostable straws throughout the whole house. But Michael will share with you how that didn't exactly work out. Oops, right here. And then the last piece was, this really aligns well with our sustainability goals. We have a 2020 goal for 50% of our total waste to be diverted from the landfill, and we're at about 47% diversion right now. Part of what's going to get us over the top is our hospital composting program, which again has been operating out of our kitchen since 2009, but now we're expanding to all our staff kitchens. So we've expanded in 2 buildings, and we have 2 more buildings to go. So I'm going to hand this over to Michael Shelton to tell you about our journey.
Hello, everyone. I'm Michael Shelton, the buyer supervisor here at Seattle Children's. I was responsible for sourcing the straws and all of our compostables when it came time. We started this in January 2018, working with our main supplier, U.S. Foods, asked them to show us any alternatives they had. We started testing the products as soon as they started sending us samples, specifically an Eco Products paper bendable straw. I knew the bendable straw was going to be the most challenging part, so that was the one we really focused on at first. There was plenty of non-bendable straws that were already stocked by our supplier. But we found out that putting the paper straw in a cup and leaving it for a while and kind of flexing it back and forth and just trying to see what happened. It didn't flake into the water like we kind of expected, but it didn't hold up all that well. The bendable portion broke pretty easily, and it got really soft after just about an hour in water. The other concern was the availability. Every company that we had that were making the paper bendable straws were out of stock, and they were going to be out of stock for at least a couple months. And that's when I started researching into aardvark paper straws, and they actually hold the patent for the most popular paper bendable straw that is out there. So even though Eco Products and World Centric make a bendable straw, they're all the same straw based on the aardvark straw. And aardvark was actually out of stock as well. They were about 3 months until they were going to get shipment back in. So we did more product testing just to see specifically if they could puncture a lid. We were looking at the non-bendable straws to see if any of them held up in hot water. None of them did, and some of them fractured when you did puncture the lid. So that eliminated some of our possibilities straight away. We ended up going with an Eco Products PLA straw for the cafe and delis, just in our retail portions. They're made from a renewable resource instead of petroleum-based plastic. It's called Ceraplast, and we are currently looking into exactly what that is composed of, trying to get an answer from Eco Products. It's compostable in our commercial facility of Cedar Grove, but not in like a backyard or a residential. And it was the least expensive option that was still on our contract, and that held up to our testing that was available through US Foods. We did look at some alternatives like reusable bendy straws, the stainless steel ones. There were some available on Amazon, and we were just really concerned about the bacteria and if we would lose some if we started going to those, if they disappear. So the cost of conversion altogether for the compostable straws that we went with in our cafeteria, the PLA straws, it only cost us about $1,000 annually to switch that over. And if we had gone with the paper bendable straw, it could have been upwards of $15,000. And then we also, at the same time, the city of Seattle required our utensils to be compostable. So we switched that over. That was a much higher cost, about $20,000 annually to switch all of our one-time use utensils to compostable. And the inpatient supply areas, which they're working on switching on, demand flow in our hospital, would be about $10,000 annually. Now I'll turn it back over to Colleen.
Great. So in terms of staff engagement, it's pretty, I wouldn't say easy, but it's pretty straightforward in the Pacific Northwest and Seattle. There's general awareness. The phased approach with our regional waste utility, Seattle Public Utilities, really helped prep everybody and get ready for it. So, I was certainly getting emails from staff talking about when are we converting to the compostable straws. And I don't know about the rest of the country, but there was a turtle video with a turtle with a straw stuck up its nose that it was certainly viral around here. And I didn't include it because it's kind of upsetting. So people were really, really ready. It was just this past summer, it seemed to hit a tipping point with straws. And the nutrition employees were really positive and engaged. Some lessons learned and next steps, I would say education first and foremost. When we decide to launch again with patients, we really are going to have to do a lot of pilot testing and pre-education with nursing. The kitchen staff, they've got two different types of straws now. One they're composting and one they're trashing. So that required some education. And for staff too, they come to our kitchen and then they go back to their units. Luckily, we now have composting in their unit kitchens in about 50% of our buildings. So that's been really, really helpful. And then, we did a lot of signs letting people know. Our marketing campaign, I have to say, was low-key, but it seemed, to get the message out. The other thing I would say is starting early. Michael really has been at this for quite a while, and it took months to get samples. And I would recommend having a few weeks of stock on hand because, again, at this tipping point, the manufacturers are really trying to catch up to demand. And knowing your regional market, I mean, here in Seattle, all restaurants, everybody at the same time had to switch. So it was very challenging for our distributor. Even though we'd been working with them for months, they had a lot of other customers who were making last-minute demands on alternative straws. So it was a real challenge. And the other thing, like Sister Mary Ellen mentioned, is, keep pushing for more alternatives. This is going to be an iterative process for us. There's, I wouldn't say we've landed on the straw we're going to have forever. I'm hoping more improved and durable products come out. But it's a journey away from single-use plastics, and it goes along with our sustainability goals. And again, it's widely embraced in the Pacific Northwest. And that is it. I will pass it back to you, Beth.
Yeah, thank you. Thank you. And before we turn to the questions, and I did want to remind everybody to submit them, thanks to Colleen and Michael. That was very informative, and we got a lot of questions during your presentation. But before we end, I just wanted to point out one thing. For those of you who are considering disposable foodware alternatives to plastic, we just wanted to point out that to be sure that products are free of what's called per- and polyfluoroalkyl alcohol substances, or known as PFAS. And PFAS are man-made chemicals, and they're used as stain and water repellents. And they're found in a wide range of products, including foodware. And they may be used in alternative straw materials. And so the issue is these are persistent in the environment, and there have been exposure can be transmitted through foodware, but the evidence of exposure can lead to adverse health effects, including reproductive and developmental effects. There's impact on liver and kidneys, as identified in lab animal studies. So we encourage you to ask suppliers if their products are free of PFAS, and we just wanted to point that out as something that was an important consideration. So thank you to all of our panelists today. It was very informative, a lot of good information, and it sounds like each of you have attested to the fact that it's a journey, and there's still more to be identified in terms of alternatives. And so I commend you on taking the lead in this effort. And we have quite a few questions that have come in. So let me start with, let's see, any of you who'd like to answer. The question is do you see if do patients, let's see, do you check to see if patient needs the straw, or do you still give a straw to all inpatients? Does anybody want to address that?
Yeah, in some of our hospitals, this is Mary Ellen, in some of our hospitals, the nursing staff does check to see if the patients would like it or not. Some of them, it's not a problem at all, and others, of course, they do need it. So the nursing staff checks with the patients.
Great, thank you. Anybody else? We had a couple of questions for you, Colleen and Michael. Someone asked if they noticed on your slide that you sort, compost, and recycle. Do you do that for all waste that is generated from your retail areas?
Yes. Yeah. So our kitchen operations, we actually in our cafe, we removed most of the trash and recycling containers. We're really pushing everyone to bring everything back to tray return, because our behind-the-house staff is just so good at sorting compost from recycling from trash. And then throughout the house, not in patient rooms, but throughout the house, we have recycling and trash. And then in staff kitchens, we've got all three.
Great, thank you. I have a question for you, Emma. I noticed you worked with a variety of different departments. how did you first engage marketing communications in the sustainability program and communication for this activity?
So since it did come from our new CEO, I think that definitely helped because I know that marketing is always so busy and we don't have our own marketing person. It really just was up to the marketing leadership to put someone on our project. So we have the director of internal communications from one of our specific hospitals, and basically he was just assigned to us, and I've been kind of leading him through it, giving him the messaging that we've talked to our cohort group about, and he is just working with creative services to do the graphics. Great,
great. Colleen and Michael, someone asked, what size facility is Seattle Children's, and what percentage of patients and customers use straws? Do you know?
We have about 340 beds. I think we're licensed for over 400, but our census runs anywhere between like 3 and 340. I don't know the second part of that.
No, I believe we default to giving a straw on every tray, but I don't know for sure what percentage uses straws.
Yeah, we'll have to look into that. With kids, it is, it's particularly with sick kids, straws are wanted most of the time. But, as a result of this, I am going to go look into that and see if I think it would be actually logistically difficult for the nurses to do that, but I am going to look into it.
Great. Mary Ellen, I have a question for you. This one really applies to everyone, but I'll ask you to start. How do landlocked states justify the plastic straws versus oceans? So I guess this is from someone that is landlocked, and how do they? What would you suggest to them in terms of driving reduction or elimination of plastic straws?
Yeah, that's a very good question. It gets the straws. Not only do they get to the ocean, but it's in the landfill, our landfills as well. And plastic is it's just that, like we call it the gateway plastic, and it's just representative of so many more pieces of plastic that we use and throw away. So the straw is not the only thing, and you don't have to have an ocean next to it, in order to stop it or to take a look at what we're doing. I think we need to look at everything we're doing, have the whole conversation around all the plastics in hospitals, of course, and healthcare, but also in our own, in our own personal lives. Plastic is just becoming, plastic is a waste, and we're really becoming more and more used to that. We don't need to be doing that.
Thank you. Anybody else want to answer that question and give advice? Okay. I have a question. I'm not sure if I understand it correctly, so I'll try. But does anyone have a one-page plan on how you promoted getting rid of straws in their hospitals? Have any of you put together kind of a one-pager on how you're doing this? Maybe that will that shares how you're promoting it. That's kind of a hard question to answer. Maybe it's a request that someone needs a one-page promotion or a one-page plan for this. Here's another one. In Seattle, people have, the culture there is more concerned about this issue. How can we bring that to their region or to their area? Do you have any suggestions, Colleen or Michael, to someone who's not from Seattle?
I mean, that's an interesting question. I'm from the East Coast, but I've been out here about 18 years, and it is different. And I would say it's not just Seattle. I would say the West Coast in general seems to be more environmentally aware, and I, not all of Washington State is, but certainly the greater Puget Sound area is. I think, as with a lot of issues, including climate change and plastics and all that, I think hospitals are a trusted voice, and when we speak publicly about these issues, I think I love what Dignity did with the kind of external marketing of this. That's given me a lot of food for thought because I think that helps drive the conversation. So I think hospitals can really take leadership positions on issues like this. Here, it's, I mean, so much is mandated. It's just, you know, part of the Kool-Aid that we all drink. But I do think hospitals can help to change the conversation.
Right, and obviously the City of Seattle's mandate supported that as well. So you may have some of your local government agencies maybe taking action or maybe looking into taking action, so that may be another driver for your organization as well. We are getting more questions in, and let's see. I'm trying to share them. Let's see. One question we just got in is, would you consider replacing, this is a little off topic, but would you consider replacing plastic bedpans with single-use bedpans made from recycled newspaper? Would anybody want to respond to that question?
This is Colleen. I have to say I've never heard of bedpans made of recycled newspaper. I'm writing it down, and it's worth looking into. What I'm not clear on is, you know, I'm assuming that still goes in. I'm not even sure where the waste stream for that is, but in any case, no, haven't heard of it, but willing to look into it.
You know, and I think we go product by product as well, and just say, okay, what is the best thing, you know, for the patient, and what is the machinery that would be needed for the bedpans from newspaper or cardboard or whatever it is, as opposed to the plastic ones. I mean, we need to, you know, take a look at the whole issue, both sides, and then make our decision from there. But you know, we look at a lot of things, so.
Yeah, and there has been a product on the market. I'm not sure if it's still on the market that would dispose of those bedpans through the sewer system. So it would take them and mash them up through the system so that they wouldn't become a waste product. I'm not sure if that product is still on the market, but that was a while back.
You know, one of the things that we did look at a few years ago, and we still purchase it, is for example, patient products and bedpans and things that are made without dye. And so saved, you know, a ton of dye from going into the landfills. Again, but it goes back to, you look at every product as it comes online and just see if this is something that you can switch to. So we do that.
And we have, great, thank you. We have another question about more resources for paper-based straws. So are there other vendors other than the ones you've mentioned that you would suggest to the attendees on the call?
So our straws, this is Emma, actually came from Medline. I know that they're not the ones producing them, but we tried to go through U.S. Foods, and they just couldn't get us the supply that we needed. So we worked with Medline to get our paper straws.
Anybody else?
Oh, we're continuing to work with U.S. Foods, but as new products come out from different companies, I mean, I bet that would be great if we could all be sharing the names of those companies or vendors so that we could all be looking at them.
This is Mike from Children. Yeah, we're continuing to work with U.S. Every manufacturer I talked to basically said that they were working on other solutions to this paper bendy straw problem. So I expect to hear back in the next few months on new products. That kind of seemed to be the theme when I was looking into it.
And did everyone share the cost difference that you found on your slides? Was there a huge cost difference for you at Seattle Children's, Michael?
The non-bendy PLA straws was only about $1,000 annually to switch over our retail to that. But to do the paper straws was a lot greater. I want to say $15,000 annually. And I'm not sure if that was mostly because nobody had them at the time, so they could charge what they wanted. So it's kind of something I'm going to circle back on in a few months and see if there's more availability and if the prices got any better.